Hi, my name is Bailey Wood. I'm the Manager of Fundraising and Marketing at CenterPoint. I'm here today to talk with some of the CenterPoint staff about mental health and well-being, our crisis response services, and how we're creating a stronger community. I'm here with Ryan Carruthers, Vice President and Director of Clinical Operations at CenterPoint. Hi Ryan, thanks for being here.
Yeah, thanks for having me.
Ryan, can you tell us what is mental health?
So mental health is a vital aspect of our overall well-being as a person, and a lot of times we think about mental health just as it relates to diagnosable mental health conditions, and really it's a lot more than that. There's a full continuum of mental health that goes anywhere from being very happy and content with my life to having a severe and persistent, what we call SPMI, a severe and persistent mental illness. Typically what we see for most people coming in the door at CenterPoint though is that they're just kind of feeling off and struggling with depression and anxiety are the most commonly diagnosed conditions that we see at CenterPoint.
So when people are seeking help through CenterPoint, what is CenterPoint's sort of clinical approach?
Yeah, that's a great question. I think it's really something that sets us apart from others in the field and the way that we provide care. We really try to meet people where they're at. And what that means is that if someone is ready to address some of their issues and maybe not quite ready to address all of the things that are going on that they're struggling with, that we are going to work with them regardless of their hesitation to address this part of the picture or that part of the picture. That we really do try to individualize care, and then we try to wrap our care all around the person, and so treating the whole person. And so we provide their physical health care through our primary care program and have basically same-day access to our primary care provider. We have mental health providers that address the mental health needs, so those depression and anxiety needs that someone has, and we have substance use disorder care. And so if someone's alcohol use or their other substance use has gotten to the point where that might be causing problems in their life, that we're going to be able to provide that kind of whole person care to them.
So what are the signs that concerned friends or family should look for in someone who might be struggling with mental health or struggling with substance use?
Yeah, that's a question we get quite a bit. Families are like, well, I'm not quite sure, but something kind of seems off. And what we tend to tell families and loved ones and concerned others is just that if something seems off, it's probably because something's a little off. And so what we really encourage people to be on the outlook for is things are changing. The person's behavior is different than it was before. They stop showing up to things on time or stop participating in community activities or things that were important to them. Work, school, church, family relationships. Suddenly those are starting to have problems in their life where before they were functioning maybe at a much healthier level. And as those things start to come up, it's probably time to reach out.
So if someone is watching this video and they're noticing those signs in themselves or someone they care about, what services are available through CenterPoint?
So like I said a little bit before, we really have a wide comprehensive list of services. We tend to group them in terms of the level of care, and so we provide residential services where people actually live in the facility as they're kind of working through their struggles. We also provide outpatient services, and the outpatient services, someone can just walk into our outpatient office and talk to either our crisis response or talk to one of our therapists that we have there that is going to be able to help identify an individualized recovery plan for that person in order to be able to help address the needs that they have. So we don't do cookie cutter plans where everybody kind of gets the same thing. What we're going to try to do is do a real thorough assessment of what is it that you've got going on? What are you struggling with, and how can we help you, you and your family, to meet those needs?
It's really great to hear if someone is struggling that there is definitely solutions and ways that they can seek help.
Yeah, and we always try to let people know that there is help and there is hope out there.
Well, thank you so much for being here today.
Yeah, absolutely. Thanks.
For more information on CenterPointe and all of our services, you can reach us at centerpointe.org. To reach our same-day service line, the phone number is 402-475-5161. And if you would like to reach our crisis line, our phone number is 402-475-6695.